Good afternoon. Welcome to a special community conversation presented by the UT Southwestern Community Organization Resident Practicum, or CORE, elective. My name is Jenny King, and as Director of Public Affairs for UT Southwestern, it is a delight to collaborate on this program. Today, we are presenting the documentary Building Momentum about the Dallas-based nonprofit Cafe Momentum and a panel discussion featuring its founder along with UT Southwestern pediatricians. Located here in Dallas, UT Southwestern is one of the nation's leading academic medical centers, or AMCs. AMCs bring together research, medical and health education, and patient care into one institution. The research and education inform care advancements quickly, which is a benefit to our patients and community. For our pediatric resident doctors, UT Southwestern partners with Children's Health, Parkland Health, and Scottish Rite for Children to provide teaching opportunities and experiences. Our faculty also provide care at these institutions. We are so grateful for these important partnerships. Before we get started, I have a few technical points to cover. We are recording this program on Zoom and live streaming the panel discussion on our UT Southwestern Twitter page. For audio clarity, please keep your microphones muted. And please list questions for the panel using the chat feature. We really do welcome your questions. With that, it is my honor to introduce Dr. Jeff McKinney. Dr. McKinney is Professor of Pediatrics and Vice Chair for Education in the Department of Pediatrics at UT Southwestern Medical Center. He also serves as Director of Medical Education for Children's Health System. Dr. McKinney is a graduate of the University of Iowa College of Medicine Medical Scientist Training Program. He went on to complete his internship, residency, and fellowship at Yale University in Pediatrics, Pediatric Infectious Disease, and Molecular, Cellular, and Developmental Biology. Prior to his medical education and training, he was named a Rhodes Scholar. I will also add that Dr. McKinney has earned both an MD and a PhD. In his role as Vice Chair for Pediatric Education, Dr. McKinney has focused on the recruitment of both nationally and internationally competitive resident and intern candidates with diverse interests. The UT Southwestern Pediatrics Training Program is one of the nation's largest and includes over 400 learners, more than 100 pediatric residents, more than 100 pediatric subspecialty fellows, and more than 200 visiting resident rotators. His overarching program goals are to foster leadership development, physician activism, and critical thinking skills among physicians in training, and to maximize their long-term professional impact. Dr. McKinney received the 2018 UT Southwestern Mentoring Award. He is a remarkable physician, educator, civic leader, mentor, and faculty leader for our institutions. Dr. McKinney, the virtual podium is yours.
Good afternoon, and thank you very much for that, Jenny. Thank you also to everyone joining us today on Zoom. It's my pleasure to welcome you to this special community conversation. As a pediatrician and now a pediatric residency program director who aims to try to help maximize each child's potential, I've come to appreciate the tremendous impact that our doctors and the surrounding community can have on a child's development. As both physicians and scientists, we are keenly aware how the social determinants of health can inequitably impact children's potentials. The resulting disparities must be addressed through interventions that are both systematically and individually therapeutic. This calls for innovative solutions. Dallas has notable innovators in a variety of fields, especially in our nonprofit community, including Cafe Momentum. It's been a privilege to learn about Chef Chad Hauser and the impact of his Cafe Momentum initiative. One of our own innovations in training young MDs has been the development of our CORE program. We established CORE in 2019 through a partnership with our former chief resident, Dr. Abigail Kissel, also here today, with the co-founder of Early Matters Dallas, Ms. Reagan Horchow, and with the division director of our developmental and behavioral pediatrics program, Dr. Richard Adams. One of my primary goals as a pediatric residency program director is to try to train the next generation of doctors to be impactful civic leaders. This 2-week seminar style elective helps equip our pediatric residents to try to achieve this. During the elective, presidents of outreach organizations, leaders of advocacy groups, advocates for education, and other community stakeholders deliver lectures and foster discussions about the social needs of Dallas children and their families. These conversations and lectures not only describe available services, but also help our residents to develop the skill sets they need to form strong partnerships with local community organizations and ultimately to serve as physician advocates throughout their careers. Over the course of my career, I've come to appreciate how important and long-lasting civic partnerships involving physicians can be. CORE brings these partnerships into our training program and enhances our residents' community knowledge and perspectives. Immediately following the documentary, we're going to hear from Dr. Sarah Sofer, our chief resident who's leading the CORE this year, and Dr. Abby Kissel, one of the original founders of the CORE elective. I'm going to take a quick moment to introduce them. Dr. Abigail Kissel is an assistant professor of pediatrics at UT Southwestern and a developmental pediatrician at the Luke Waits Center for Dyslexia and Learning Disorders at Scottish Rite for Children. Dr. Kissel received her BA in biology and psychology from Northwestern University and her MD from Baylor College of Medicine. She completed her pediatrics residency at UT Southwestern and Children's Medical Center, Dallas, where she served as one of our chief residents for the pediatrics program. She also was in the first cohort of recruits that I was lucky to attract here. Her research includes behavior and development in chronically ill children and factors affecting behavior and development in adolescent youth. Also joining us in a bit is Dr. Sarah Sofer. She is a current co-chief pediatric resident here at UT Southwestern in Children's Health. She attended Tufts University, where she completed the combined BA and Master Public Health program with undergraduate majors in child development and community health and an MPH concentration in health communication. She received her MD from Emory University and completed her pediatric residency training here at UT Southwestern. She was a member of Dr. Kissel's pilot CORE elective cohort in 2019, and now she's helping to lead this year's CORE elective. This summer, Sarah will move to Boston to pursue her fellowship in developmental and behavioral pediatrics at Harvard. And now we'll play the documentary, Building Momentum. After that, Dr. Sofer will share a few remarks about CORE, and Dr. Kissel will moderate the panel discussion. We plan to end today's session by 1:15 p.m. Thank you.
A fantastic documentary about a truly remarkable program. Thank you so much, Chef Hauser, for your vision in creating the Cafe Momentum program. It provides a beautifully crafted combination of the social, emotional, and professional support needed to help participants achieve their full potential. Before we get started with the panel led by Dr. Kissel and our guests, I wanted to say a few more words about the CORE elective. The reason we are here today is to educate our pediatricians in training about the importance of community programs and how these programs support our patients outside the walls of our institutions. This CORE elective combines our passions for pediatrics, public health, and service. Following the example of one of the more well-known child educators, Mr. Fred Rogers, and his call to always look for the helpers, we have designed CORE to be a showcase of the best of the helpers in the greater Dallas area. My hope is that our resident physicians will graduate from the program and go out into the community to not only be excellent pediatricians, but also engaged helpers. I concur with Dr. McKinney that civic engagement as physicians is critical. We are better doctors when we fully understand the comprehensive needs of our patients and their communities. Dr. Kissel, Ms. Horchow, and Dr. Adams's vision in founding a CORE has made it a distinguishing factor for the UT Southwestern Pediatric Residency Program. And so it is my pleasure to turn over the virtual podium to my mentor and fellow pediatrician, Dr. Kissel, to lead our panel discussion.
Wow. Thank you, Dr. Sofer and Dr. McKinney, for those wonderful and thoughtful introductions to the program and the film. I feel ill-prepared because I did not bring tissues, but I will join with my thanks to Chef Hauser and Dr. Erica Bomer, also to our core seminar and guests, and our virtual audience who are joining us today. We're going to have a discussion about the impact of nonprofits on children and youth. And specifically today, we're obviously focusing on the inspiration provided by the impact and services of Cafe Momentum. I want to get started with our panel discussion, but to do that, I have some introductions of my own, and I will start with Chef Chad Hauser. Chef Hauser is the nonprofit founder, CEO, and executive chef for Cafe Momentum. He has described Cafe Momentum as, and I want to make sure I wrote this down correctly, taking kids out of jail and teaching them to play with knives and fire. We'll talk about that afterwards. Levity aside, it really was his vision for systemic change and his passion for our country's future and obviously its youth that led him to spend the last decade building what's now a proven model that teaches life skills, employment skills, and social skills to justice-involved youth. After 17 years as a chef, Chad sold his partnership with Parigi Restaurant to devote his full attention to the role of executive director of Cafe Momentum. That was in 2012. In 2020, he co-founded Momentum Advisory Collective, which is a nonprofit organization really built to scale the Cafe Momentum model up to a national level and serve as a model for juvenile justice across our whole country. Dr. Erica Bomer, our other panelist, is a child abuse pediatric fellow physician at REACH here. REACH stands for Referral and Evaluation of At-Risk Children. It's a clinic at UT Southwestern in Children's Health. She received her undergraduate degree and attended medical school at Southern Illinois University. And she completed her pediatric residency at Phoenix Children's Hospital in 2020. And we were lucky enough to have her join us in the fall of 2020 here in Dallas. So welcome to you both. I have, luckily, some eagerly pre-submitted questions from people who knew they'd be joining us virtually. We welcome you to drop any current questions in the chat, and we'll be monitoring that. And then as moderator, I took the liberty of some personal questions to help the discussion along. So I will get started with Dr. Bomer. Just laying a foundation, can you explain to us sort of the nuances of mental health care versus behavioral health care, how they're similar and how they're different?
Yes, and thank you for your introduction. So I think most folks are in general familiar with mental health care or mental health. So we think of that as our mood and our emotions and kind of how that affects our overall health. Behavioral health, though, is kind of the connection between our behaviors or our repetitive actions, not a one-time event, but the things that we typically do and how those behaviors or actions affect our health. And so mental health is a part of behavioral health, an important part, but you can also have behavioral health impacted by your physical health or even by your environment and surroundings. And so while they often go hand in hand, they are two distinct different entities.
Thank you. Very helpful context. My next question is for you, Chef Hauser. Clearly, you've created something amazing with Cafe Momentum. However, I heard through the grapevine that you were also a featured Super Bowl community event dinner in LA this year. So here, we're in such awe of the program. How do you think the concept was received there?
It's interesting to me going back and doing dinners around the country, and certainly at the Super Bowl takes me back to 2011 when we started doing pop-up dinners here as an opportunity to build advocacy in the community for the cafe minimum program. And you're always met with a lot of, probably the most simplistic term to use would be disbelief. There are such stereotypes in place about the young people that we work with. So for us to go in 2 days prior to our dinner and spend a total of 4 hours training 10 justice involved youth in LA, and to see them performing at such a high level at one of the top restaurants in LA is kind of jaw dropping to attendees of, I didn't know that they were capable of doing this, which then turns the attention to what can I do? How can I do more? How can we see this more? Which is, I think, very rewarding for the young people that we serve, and very validating and motivating for us to keep pushing the conversation across the country.
Sounds like it was received really well. You built a lot of momentum. I can tell. I can tell.
Can you imagine the puns?
Can you imagine? No, seriously. We wish you tons of success, obviously, as you scale this up and take it nationally. It's a huge endeavor, but it sounds like you've got the footholds in place. My next question is for Dr. Bomer. Can you talk a little bit about what we mean when we say social determinants of health? Dr. McKinney mentioned it earlier. And obviously, when we started the core program, we were looking at that intersection between our community organizations, our community partners, and the medical experience that our pediatric residents brought to a conversation in a world where we're all dealing with these social determinants of health. But talk to me about what they are and how they're in play, especially for our kids and youth in Dallas.
So social determinants of health are the pieces of one's life that have an impact on their overall health that are not related to genetics, but are related to kind of the environment that they are exposed to and the resources that they have at hand. And so to bring an example of this, one thing that was laid out very nicely in the documentary is something in terms of public transportation and how some of these youth can only get to places that are available in that manner. And so a person who has their own private automobile and can afford the rising gas prices to get to the places that they need to go, you're looking at a whole different world of opportunity as compared to that person that's stuck to the public transport. So that's just one example. There are many.
Please call 6570.
Benefits of Zoom.
Someone's speaking. But yes, so there are many ways that that your community can kind of play a role and can really impact your overall health and your access to healthcare and all of that.
Thank you. Thank you. Back to Chef Hauser. The next question is, what are the best ways to advocate for justice-involved youth in your community or in one's community?
Not to become overly redundant, but I think Dr. Bomer, in just talking about the social determinants of health, really laid out the roadmap, which is that we as a community dictate and have a responsibility over so many of those things, like public transportation. We elect people that make decisions about public transportation. We elect people that make decisions about building across the community. Just thinking about south of Interstate 30 here in Dallas, there are 3 grocery stores. We, as a community in Dallas, have opportunities to make those changes. It's not the responsibility of our young people to build a grocery store. It's the responsibility of us as adults in the community to demand that access, that all people in our community have access to basic things like food, shelter, because we've seen what happens on the other side. We know what happens. We watched it in the documentary. We see it in the work that you all are doing every day. But so I think for us specifically is building that conversation and continuing to push the conversation that we have the power to make this change as a community.
Very powerful. I am going to push you one further and say, if you had to tell us one takeaway about working with justice-involved youth, what would it be?
that they are the strongest human beings I have ever met in my entire life. To know their stories, to understand what they have overcome. And you heard Dr. Heyman in the documentary talking about her definition of resiliency. My biggest takeaway is I don't know that I'll ever be as strong a human being as any of the young people that I've worked with. And I just think if we can channel that enormous strength into opportunity, they could truly be game changers for all of us.
I agree. Dr. Bomer, I would say your work, as well as my work, many of us here's work, involves guiding kids and families through often very complex social circumstances. Sometimes that involves what's known as adverse childhood experiences, or ACEs. So I'm going to ask you a two-part question. I'll remind you if you need the second part. The first is, can you speak to this idea of ACEs and to the newly emerging thoughts on hopes or healthy outcomes from positive experiences? The second part of that question, of course, is how could something like Cafe Momentum have the potential to contribute to those healthy outcomes?
So ACEs are something that I learned about in medical school and have been really passionate about since. So they are adverse childhood experiences, which are basically just life events that happen during childhood that have a tremendous effect on that person's development and health outcomes throughout their lives. And so, for example, some of the adverse childhood experiences that the initial study that was performed that they were looking at were things that children would, of course, have no control over. So things like living in a single parent household or having a parent who was incarcerated, things like physical abuse, sexual abuse, these all play into adverse childhood experiences. If you think about it, when we are faced with really traumatic, stressful events, our body goes into kind of that fight or flight mode. And during childhood, a lot of critical brain development is happening. And so when a child is in that fight or flight mode throughout that period of critical brain development, they really don't have time to develop and reach their full potential, if you will, to be able to function really as a healthy adult, in comparison to someone who, really didn't experience all of those things. So the idea of healthy outcomes through positive experiences, this is an idea of building that kind of resiliency that Chef Hauser touched on earlier. So it's about actively setting up scenarios for these children who have faced some of the most difficult traumatic experiences, so that they can harness that ability to build things like self-esteem, confidence, empathy, really important social skills, and to not constantly feel that fight or flight at all times. Cafe Momentum, I think we've seen through the documentary several ways that they are doing that. But some of the most important ways is really just being somebody who is supportive to these children, being good role models and letting them know that they matter and providing them with life skills and confidence going forward.
I have to admit, as a developmental pediatrician, you had me at critical brain development. But no, really, thank you both. You've had such enlightening answers, and obviously thank you for your work with kids and youth in the community. I do have one, if you'll indulge me, sort of lighthearted question for Chef Hauser, which is, what is your favorite thing either to cook or teach to cook at Cafe Momentum?
Well, this is a two-part answer. I've been really excited. We're a scratch kitchen, so we get raw goat's milk and make our own cheeses. We get cow's milk, make our own cheeses, roll out our own pastas. We break down animals and make our own charcuterie. And a lot of the work that we do in wanting to be a fine dining restaurant is to prove to the young people in the community that they can and will rise to whatever level of expectation we set for them, as long as we are providing them with the tools and resources and opportunity to do so. which always makes me laugh because the most acclaimed dish at Cafe Momentum, the only dish that has not changed since we opened the restaurant, is our smoked fried chicken. So I was laughing thinking I'm trying to be a really fancy chef, but at the end of the day, I'm known for fried chicken. So
I love that. It is Dallas.
What's the old
So-
saying? Be humble or the world will humble you.
Well, I think it's perfectly appropriate for here. Yes. Okay. We have some live questions coming in through the chat. And so I wanted to ask either of you, it's probably more directed at Chef Hauser, this question from our audience, which is, are there other similar programs you know about around the country that help the juvenile with other skills? So I guess similar to your cooking skills program, a different skill.
There are definitely different programs around the country. I don't think that any of them take necessarily the holistic approach or program design by specifically. Our program is designed by the population that it serves. But you do see some other in retail services, a lot of STEM programs, and I think I already mentioned retail. Retail, STEM, and specifically within STEM, I know specifically of programs that are teaching coding to youth. I think it's important. That's a great opportunity, though, for me to point out that our program is built around a restaurant as a workforce development vehicle, as a public-facing vehicle, but our program is not designed in any way, shape, or form to push our young people into the food service industry. I don't want any more chefs. The competition is steep enough thanks to Food Network. But the reality is we want our young people to set their own path and look at, where they want to go in life. The young lady that you saw that was studying to be a medical assistant, graduated magna cum laude. She is now a medical assistant in the gastrointestinal unit at Children's Hospital. We have a young man that won an award from NASA and wants to go work for them, one that's in the Navy doing medical assistant work there. They get to define their own path. We just use the restaurant as an opportunity to help them hone in life skills and social skills to get them there.
I love that. And I think speaking to that holistic approach and those wraparound services, we have another question from the audience from Chris. Was behavioral health support part of the Cafe Momentum program from the beginning?
Oh man. I can honestly say that the program that we have today was not the program we started with. And again, that goes to a lot of learning. We spent 3.5 years doing pop-up dinners on a monthly basis. Our young people can easily choose what they want you to know about their lives when you're only engaging with them once a month. And they will choose to because they're still figuring out if they trust you or not. Once the restaurant opened and we're working with young people 5-6 days a week, we began to see where the cracks were and that they were falling through. And they began to openly talk about them. So that's when it was at that point in time that we focused on more intensively on behavioral health. I mean, we knew things like public transportation, we knew things like particular issues within the home, access to things like food, but to the extent the grave extent that they occur, we weren't fully aware. So we've built around that.
Perfect. I think I know the answer to the next question, but I'm going to ask it. It's from an audience member, so we can all hear you answer it. Is Cafe Momentum looking to open any additional locations and/or support centers in other areas?
In fact, we are. I always say that I have a really acute sense of making really big life business decisions amidst world events. So I sold my house, took all the equity out of it, and bought into a restaurant in 2007 as the economy tanked. And I launched another organization to oversee the expansion of the Cafe Momentum model across the country called Momentum Advisory Collective in March of 2020. So 2 for 2 in catastrophic world events. And
There you go.
But Momentum Advisory Collective is currently working on building Cafe Momentums in Pittsburgh and Nashville. Pittsburgh should be open towards the latter part of this year, and Nashville early next year. And we'll continue, our goal is to continue adding 2 models a year and then eventually increasing that to get to 30 over the next 10 years.
That's wonderful. And I think we saw some of that right at the end of the video, right? Talking about the goals for the expansion.
Yes, ma'am.
Our last question is actually for me, Dr. Kissel. And may have been a plant by one of my friends watching, but it's Dr. Kissel, can you expand on how the core idea, the core elective came to be? And I could expound and expand on that for a long time, but to keep it succinct, when I was a pediatric resident going through residency, I had submitted my application with the buzz terms that we see a lot, community advocacy. And as I spent so much time as a resident really learning how to be a great doctor within the hospital and in clinics, learning how to do procedures, I felt like I lost a little bit that thread of community connection and advocacy. So when I became a chief resident with Dr. McKinney, and then subsequently a developmental behavioral pediatric fellow, I decided I wanted to design a program to help our residents continue to weave that thread of advocacy back through their residency experience. And in doing so, hopefully create some graduates that were leaders who would go out and work with community organizations, because we do have a lot to give as medical professionals, either serving as a medical liaison or advisor to a board, or many other capacities. And then even more so, we have a lot to learn from these community organizations and people like Chef Hauser, and places like Cafe Momentum. So that was sort of the inspiration behind CORE, which has culminated in our program today. And I'm looking at responsible parties, and it seems like we're about to wrap up. So it's been a very educational hour with everybody. Thank you to Chef Hauser, to Dr. Erica Bomer, Dr. McKinney, Dr. Sofer, for all of the insight today. Chef Hauser, again, we wish you continued success as you begin to expand this amazing program across the country. To our CORE participants and our virtual joiners today, thank you so much for engaging and asking questions. It's really been amazing to be here. And lastly, we have to thank Scottish Rite Hospital, as well as UT Southwestern and Children's Health, for both supporting the CORE elective and then making today's programming possible. So with that, we will say, there's another announcement. Have a great day, and thank you again.